Now, morphologically, bronchiectasis is classified into three variants. Okay, number one is known as cylindrical, and this can also be called as tubular bronchiectasis. Tubular bronchiectasis. Okay, number two is called as varicose bronchiectasis, and number three is cystic. In terms of severity, cystic is the most severe, and among the spectrum, relatively less severe is your tubular. It is less severe, and your varicose sits somewhere in between. Okay, now what is the difference between the normal bronchial tree and when do you say that the patient has cylindrical bronchiectasis? One thing is very clear, that in case of bronchiectasis, the bronchi are dilated, abnormally dilated, and the bronchial wall is characterized by thickening. Okay, but when you look at the image of a normal bronchial tree, what you see is as there is branching of the bronchial tree, the subsequent branches there is tapering. Like you can look at this image, as you see the branching, it keeps on tapering. It is not like a parallel railroad track, right? It keeps narrowing down. But in case of the cylindrical bronchiectasis, these dilated bronchi are maintaining the parallelcy. Right? Can you notice that? It is like all parallel. It is not tapering down like this, right? It is not tapering down. It is maintaining parallel. That's why it is called as tubular. It is like a tube or it is like a cylinder. That's why it is also called as cylindrical. In case of varicose bronchiectasis, there is varicosity like dilatation and constriction. Like you can see in this image, there are abnormal segments of dilatation at multiple levels, and in between that there are zones of normal or constricted airway. That's why it's called as varicose. And in case of cystic, as the name says, there is cyst-like or a grape bunch-like collection of dilated bronchi, right? So you can see that it is like cysts. That's what is called as cystic bronchiectasis.